Hey, everybody. This is Jordan McConnell with the Crohn's Veteran Podcast. Thank you so much for joining me today. Today, I am welcoming physical therapist Sharon Hepburn and massage therapist Larry Wern to the Crohn's Veteran Podcast. They are core to a group that has developed a hands-on therapy shown to decrease intestinal adhesions, strictures, and even bowel obstructions without surgery. Their work is exciting and unique for two reasons. First, it's all natural with no drugs and no surgery. In fact, it is being used regularly as a replacement for major bowel and adhesion surgeries. Second, their therapy has been cited as safe and effective in some respected peer-reviewed medical journals since its initial development over 30 years ago. Again, Larry, Sharon, welcome. How you guys doing today?
Thank you so much.
We're doing wonderful. It's wonderful to be here. Thank you so much. And again, I was talking to you before we started. What a kudos to you to roll out this podcast, to be a veteran, to be working with Crohn's for so long, and then bringing this information to the public. So great job. Kudos to you. And thank you so much for having us on.
Awesome. Well, thank you. Well, the pleasure is all mine. And Larry and Sharon, let's get started and give the people some knowledge here. So first off, if you guys could maybe give me some history of your work, decreasing adhesion, strictures, and bowel obstructions.
So I'll start because Larry never likes to toot his own horn very much, so I'm going to toot it for him. Larry and Belinda. So Larry and Belinda are married, and I was going to show a picture of Larry and Belinda, but my screen sharing's off. So Larry and Belinda were married, and Belinda was diagnosed with cervical cancer. So the cervix is on the bottom of the uterus. And how does this relate to Crohn's? Hold on, we're going to get there. She had 8 weeks of radiation, external radiation, and then she had internal radiation, where they actually had to put little pellets in a metal tube, and they put it in her vagina, and she had to sit in a lead-lined hospital room for 72 hours.
Wow.
And she said it was excruciating me. And she had to do that twice. So she had 8 weeks of radiation plus this internal radiation. Cancer was cured, but it irradiated everything else in her pelvis. So she was having bowel issues and bloating and abdominal issues and pain like you would not believe. She actually had to stop working for a while. Wow. Because of all the adhesions that formed with that radiation. So that adhesions just really locked down her pelvis. So through an act of love, Larry and Belinda really looked at how to help decrease these adhesions. Believe it or not, she's a functioning physical therapist now. And with their technique, they were able to help her adhesions and help her, her small bowel obstructions and everything else that's been going on. So as they were helping her and they started to work on chronic pain patients, they actually opened up fallopian tubes, which is actually, you're like, well, how does this lead to Crohn's? But Larry, tell us about the fallopian tubes and how that led to your first bowel person.
Good. Let's talk about, first, let me just touch base a little bit, starting at the beginning. Adhesions are internal scars. So they are composed of tiny strands of collagen. They're little microscopic things. And when you have an injury or an inflammation, such as Crohn's, in any sort of a surgery, these scars these little strands come in and they start laying down on top of each other, and they bind to each other and create an internal scar. And that's what an adhesion is. Once you have healed, hopefully you heal, whether you take antibiotics or whatever, once you have healed, those scars remain inside of you. So they become like an internal glue inside of you. They become like straitjackets in cases of Crohn's, really, for a lot of people, where they'll attach from inside an organ or from one organ to another. And then you can't walk or move or breathe without pain in her case, in Belinda's case, and my dear wife's case. So what the significance of with opening block fallopian tubes, these are these tiny little structures that are designed to carry a single cell deep in the pelvis, right, halfway between the front and the back. We were opening block fallopian tubes and they were having babies. Well, all doctors knew about treating adhesions before this was surgery. And the problem with surgery is it virtually always causes more adhesions and more scarring as your body heals. So you can have the most compassionate and wonderful surgeon that is around, but he or she cannot help but create new adhesions. So, so after publishing some with some gynecologists, the chief of staff of the hospital read our studies and read our hit charts and said we need to start publishing on this. Then people with digestive issues and people that actually had bowel obstructions and were having more than one bowel obstruction because they've had another surgery, now it's caused another obstruction and so forth. They started calling us and saying, well, wait a minute, if you can open these little tubes, how about bigger tubes? You know, how about my intestines? Because food's not going through there, I'm going to die. I end up going to the hospital. They put an NG tube in my nose. They put IVs in me just for nutrition and to keep me alive. And the writing's on the wall. These doctors say they don't want to do surgery again. What am I supposed to do? So I kind of went off a little bit off of your question, Sharon. But that's what we do.
Oh yeah, I mean, I actually just met somebody, recently that
Can't hear you.
Yeah, I actually just went through. Actually, can you guys hear me?
I can, yes.
Okay. Yeah, I actually just met somebody recently that that was living with
I hear you.
I guess the IBS-C, I guess you would call that, right? And irritable bowel syndrome with constipation, and that person had to have surgery, and have a few inches of their colon taken out, and so I'm assuming if life was fair and they knew about this kind of this kind of therapy, beforehand, they might have been able to avoid that, right?
Right.
And
Absolutely.
okay, and so yes, and also one of the previous hosts, the co-hosts of the Crohn's Veteran podcast, her name was Renika, and one of the things that she did to kind of help raise awareness for Crohn's disease was talking about the relationship with women's reproduction and Crohn's, and so kind of thank you for kind of explaining that a little bit for for the women that are out there that listen to this show too, and so I guess from there, so Larry, maybe if you could go into sharing how successful you've been treating these adhesions for people, these kind of breaking up the scar tissue.
Sure. Yeah, we've always liked to feel comfortable looking people in the eye and saying we think we can help you or we don't, or this is what our success rate is, because it's just the way I was raised. You don't just pick a number out of the air, you find out. So we hired PhDs to find out what the heck we were doing, and we can talk a little bit about that and the structure of adhesions, and also to write some studies. In the latest study, we had this physician. She taught surgery at Harvard Medical School for 20 years. She moved to Stanford, which is sort of the Harvard of the West Coast, about 5 years ago. She and a gastroenterologist, another surgeon that Sharon knows and works with, and he's well respected, Dr. Weinstock, they did created a study about us. And what we saw was that people that were having bowel obstructions and bowel obstruction surgery, or just going to the hospital again and again, it was just recurring again and again for us. And as we were starting to clear bowel obstructions, people were saying, I feel great, I can eat better in a lot of cases, not all cases, but I can function better, I have less pain. And so we started tracking recurring obstructions. We did a phase 2 study, which means over 100 people in the treatment group and 100 people that we didn't treat. And the ones that and all of these people were having recurring bowel obstructions. They had at least 2, and in some cases, many more. The ones that we were treating happened to be much more complicated and older. So the deck was a little bit stacked against us, but we wanted to do a study. So controlled study is the best way to do that. In the end, we tracked who was having obstructions after we treated. In the end, 15% of the patients who we did not treat had another total bowel obstruction within 90 days. And less than 1% of the ones that we did treat had
Yeah.
another bowel
Wow.
obstruction. So it was holy
Well,
cow.
well, folks, you heard it from the man himself.
Yeah, yeah.
Right there. So, this, in the right circumstances, and, after talking to your doctor and then making sure that's something good for you, that's pretty impressive. That's pretty
Yeah.
impressive.
And we work closely with physicians. And when we do screen people, Jordan, we screen them and say, we don't see a potential problem, or we see something that you need to talk to your physician about before we're going to treat you. So most people, it's been pretty neat saving people's lives using just these. It's no drugs and no surgery, so it's in its infancy. But 3 doctors have told us that we should win a Nobel Prize, or could. Don't know it will be posthumous if that ever occurs, but Sharon and I just enjoy saving lives, as do our other therapists.
Right. That's what it's about, is, it's making an impact, helping people. Right. And so, yeah, I mean, I said, my story, personally, just to remind folks that, that haven't heard, recently, is that, I was diagnosed with Crohn's disease in 95. I had kind of emergency surgery. I was, fine on Friday. I was very sick on Saturday, still sick on Sunday morning, and went to the emergency room. I was there for 5 minutes before they told me to strip down where I was standing and, and put on a gown. They put me into the emergency on the table, and they kind of exploratory surgery that resulted in 6 inches of my colon taken out and my appendix taken out and Crohn's disease. And then so for about, I was in the hospital for a week or so, home for a week. And then I had no symptoms pretty much at all for the next 13 years. And then in 2009, I was very sick again for about 6 months. And I went to the emergency room, I think 4 times that year for pain. The third time I had a temporary ileostomy put in. And the fourth time I was admitted to the hospital, and they took another 18 inches of colon out and our intestine out, and then my ileum out. And the traumatic part about all that is not only did all that happen, but I had no anesthesia for 2 days. I had a catheter and a epidural and a feeding tube all taken out while I was awake with no anesthesia and all these things. And so that's part of the reason that I'm here, raising awareness and trying to help people, and and looking for therapies that can not prevent people from going through some of the stuff that I went through. And so with that, so Sharon, so how would you say, when you're actually feeling on on somebody's, I guess, abdomen, in this case, can you actually feel those those adhesions dissipating, dissolving, and can you describe that process and what that feels like, please?
Absolutely. And so to answer your question shortly, yes, absolutely. We could feel these adhesions slowly dissipating. A short story. I had a physician come in and ask me, could you please show me what you're feeling when you feel adhesions? Now I have over 30 years of feeling adhesions, and this surgeon had, 25, 30 years of having surgery. And I'm like, oh, here's one, here's one, here's one. And he's like, I don't feel anything. So just FYI, if you're asking somebody who's not trained to feel adhesions, it would be like asking me to do surgery. I'm not trained to do surgery. I would never want to. So it's very difficult to ask somebody who doesn't know how to feel adhesions how to do it. But it kind of feels like a bowl of cold spaghetti. Do you know when you put that in the refrigerator and it's all cold and congealed and it doesn't move, and you couldn't get a spoon in there and you can't twirl it around? Well, we go in there with some really deep, deep pressure, and we start really pulling these adhesions apart one by one. So eventually that bowl of spaghetti just is really movable. But what that really is your organs are now movable, right? And
Mhm.
so here's the lumen of your intestine. I'm showing a hole in my fingers. If we're having an adhesion and it's causing an obstruction, we can't get any food through that lumen, through the hole.
Right.
But if I loosen that adhesion, all of a sudden you start getting more more food through that hole, and you can absorb better. You talked about malabsorption syndrome. You can absorb better. You're not having the bloating and the distension and the pain. Let's be very clear. Clear passage does not treat Crohn's. It does not treat the inflammation process. So we know that Crohn's is an inflammatory process. Anything with inflammation, which would be Crohn's, infection, trauma, radiation, surgery,
Right.
that all causes adhesions. Clear passage treats adhesions. And it's just really cool. It's really cool to be in the room with somebody and they can feel as they begin to relax, and they can feel the abdomen softening, and they can feel food passing through. And what is so cool is when the next day somebody comes in and says, I just had the best bowel movement of my life, or I was able to eat something that I haven't eaten in years. It, like Larry was saying, oh my gosh, what a great feeling.
I
What
bet.
a tremendous feeling.
I know. I bet. I can definitely, have compassion, empathy for that, for that kind of thinking. So that's wow.
Jordan, having undergone surgery yourself more than once, now that you've shared that, I don't mind mentioning that.
Mhm.
Sharon, you have some films of a patient that was scheduled for emergency surgery because
Yes.
the which part of the image is that you drink this malted milk kind of structure stuff. It's what it shows. The white is the inside of the intestines, and on the left side, this is a 6-inch long stricture. The inside of this woman's intestine was narrowed to the size of a coffee straw for 6 inches on the left side. And the doctor said, we're scheduling you for emergency surgery. This is Sharon's patient. The patient decided to come in, and after she treated, that's the same patient afterwards. And the doctor and the radiologist said, that's normal intestine. I'm not treating that. There's no reason to cut that person open. Here's another set to the right, and this one shows an hourglass stricture. It's that lumen that she was talking about, just getting squeezed down
Yeah.
to a pinhole, and food wasn't going through. Again, the surgeon said, I need to take out both sides of that and reattach and hope a little bit of the inside doesn't flow out, because then it's going to cause peritonitis during the surgery. So it's complicated surgery. I'll do it if I have to. Bam, the woman comes in, the patient comes in to see Sharon, and this is after treating Sharon before going to surgery. They said, oh my gosh, this is totally normal bowel. I'm not cutting this woman. I'm not doing any surgery on this person. This is normal bowel. So it's been useful having medical schools around us. Sharon works with Washington University there in St. Louis, which is a very fine research school. We work with University of Florida here to get our PhDs, biostatisticians and physicians, experts, to help us to really understand what we're doing here, and to be able to take something from that narrow for 6 inches to
It's
wide
amazing.
open.
It's amazing.
It is. It's really cool. It's
It's
another Crohn's patient I just had a couple of weeks ago. He had multiple surgeries because of fistulas. Again, we're not treating the fistulas, but we're treating all of those. And Jordan's raising his hand going, me. Yes.
Right.
So then, yeah. He had to quit work because he was obstructing so often. And he got a clean bill of health. His doctor actually gave him a clean bill of health, and then he
Man.
was able to go back to work.
Yeah, I didn't know that. I mean, that's the reason I didn't bring up fistulas. Is because I didn't know that that's what something. So to clarify, is that something that you can treat the symptoms of that also?
The fistulas, no, he had surgery removing the fistulas and then was obstructing because of them.
Oh, okay. Yeah, it's anybody. I don't wish that on anybody. So that is not fun, not fun at all. So I'm happy you're able to help them after the fact. And um, so I guess if somebody is listening to this and feels like, wait a minute, I think I might be a good candidate for this therapy, how would they go about reaching out to you guys?
Probably the best way is to just go to the website. If you go to clearpassage.com, you'll go to our website, and on every page there's a little button. Here it's shown on the right. It says apply for therapy. Yeah, there's one. And there's another gold button that takes you to the same place. I think it's called free consult. And what we'll have you do, what we'd really like you to do, is complete a medical history questionnaire. It may take you 20 minutes. It may take you 30 or 40 minutes. It's fairly extensive, but we want to know all about you. We want to know your history, and we want to examine it thoroughly and come back to you with any questions if we have questions. But then we'll review that. There's no charge to you for any of that. We'll review that with one of our directors. We'll review it, and we'll see if you seem appropriate. If you seem appropriate, we'll let you know. And we do have about 10 locations now, from Los Angeles to London and Canterbury, England, right where the channel comes across for the Europeans. And so New York, and main offices are in Gainesville and St. Louis, but also Los Angeles and Dallas. And so
Yeah, that was something. Thank you for answering that question, because I'm thinking, hey, I'm pretty sure they said they were in Florida. So so how is somebody somewhere else in the country being be able to take advantage of this? So you answered that question. So thank you.
Yep. And the website really is extensive. We have great Better Business Bureau reviews. So go to the BBB, check out our reviews, our Google reviews. I mean, people don't say mean things about us. Also, Larry and Belinda wrote a book. If you just want to learn more about adhesions,
Yeah.
go to Amazon and look up, it's called Adhesions, The Body's Inner Menace. And it's Larry and Belinda wrote it. Is there a cure?
I'm gonna do my best to remember to put that into the description of this podcast so people can go out there and find it. So cool.
The other thing that people will want to know is because most people fly in or drive into one of our locations for therapy. So what the process is, once you're accepted and go ahead and put down a deposit, people come in on the weekend, and we start Monday morning, 8, 9 o'clock, sometimes 10 o'clock. We have an initial evaluation for a couple hours, and then a break for lunch, and then some more treatment in the afternoon. And we'll do the same thing without the evaluation. We'll just keep treating and teaching you all about adhesions, what's going on in your body, how do you find them in yourself, where are we freeing them up. And so you're done on Friday afternoon. Usually people that have had bowel obstructions, we suggest you may want to stay an extra day, not for therapy, but just to let your body kind of settle down and reach homeostasis before you get in a plane, because of the changes in pressure in a plane. But it's a 1 week program. We'll give you a lot of education and things you can do at home for yourself. They don't take a lot of work. They're maybe 20 minutes a day, Sharon, 15, 20
Right.
minutes a day for the first 6 months or so. And then you can start tapering off of that even. But so it's quite educational, and it's designed really for out of towners. So you come in on a Sunday and start Monday morning, and you go home the next Sunday. So that's how it is.
Cool. Well, thanks. Thank you for that rundown. While you were talking, I was thinking to myself, like, so if your intestine is not completely blocked, and like how does somebody ascertain, whether, whether or not they had, they had these adhesions in their stomach, before it gets to the point to where I need surgery. Like, how can somebody like almost like doing like, I don't know, breast exams or something, and finding, okay, I found a lump. Now I can go to the doctor and, they can help me. So like, how about, finding that same kind of the same idea in your, in your colon? Like, how can somebody, try, maybe find out, oh, that feels like old spaghetti. So like, how can I should probably go see Clear Passage. Like how can I, how can I, find that, before it gets to, code red type thing.
Right.
So it's really by your signs and symptoms, right? Because if you're functional, things are moving through absolutely well. But it's all these people who are having these partial obstructions, and you've heard about them. Oh, well, I was down with like some abdominal pain for a couple of days or 4 hours every time after I eat, and it might be starting to grow worse. It's the bloating, it's the distension, it's all those red flags that you people who are obstructing have. Pain or the constipation, the throwing up, the inability to pass stool, all of those are indications that you're obstructing or having partial obstructions. So some people are like, it happens like once a month, and they're able to tell me, I have it and then it goes, I have it and then it goes. That's when we really want to catch it, right? Because then you're not at death's door and they wanting to remove 4 inches of your colon. You want to catch it, hopefully, why these adhesions are still small and the foods are still passing through.
Cool. Okay. Well, I was just curious. Thank you. So
Yeah.
awesome. Well, I guess, guys, maybe some parting wisdom. You guys have both been doing this for a long time, right? And so, so the people with Crohn's and colitis, I know that are out there. Do you have any maybe words of wisdom or any maybe tips and tricks, that that may be helpful?
Well, one thing to think about is,
In your in your own domain, I guess. Right.
Right.
yeah, I mean, I don't know if this will help or not, but when when you have a condition, generally speaking, it's either organic or it's mechanical. And medicine is pretty good at chasing down organic conditions, diseases, bacteria, hormonal things. If you're having pain and you're having these kind of symptoms that Sharon is talking about, and nobody can figure out what it is, it's probably mechanical. Adhesions, unfortunately, do not show up on X-ray or MRI, just like the X-rays you saw of Sharon's patient. You cannot see the actual adhesions because they're composed of collagen, which is so prevalent in the body, it just doesn't show up on any of these tests. You can see the effects of them. But if you're having symptoms and you don't know, and you don't really know what they're coming from, and nobody's able to put their finger on them for what it is, suspect something mechanical, and just go ahead and write us and send us a medical history questionnaire. Give us some of your history. We'll be able to give you some insights and some intuition. You may decide to come in, you may not. Nobody's going to pressure you about anything. Of course, we love the work that we're doing because we love saving lives and giving people back the quality of life. But that alone can be helpful, and as I say, is absolutely free. And there's some of my parting thoughts.
Thank you, Larry. Appreciate that, Sharon.
So Larry has trained all of his therapists to listen to the patient, to listen to the person on the table. And then we train our people to listen to their body. So that would be my words of wisdom. Listen to yourself, listen to your gut, literally your gut, and then listen to your gut feelings of, am I in trouble? Do I need more help? Are people listening to me? Do I need to be listened to more? When you really tune in and you take control, just like you have, Jordan, you've taken control of your destiny and of your Crohn's. When you start taking control of the disease process and not being bowled over by what other professionals say. You'll know exactly what to do and when to do it. So my piece of advice is to listen.
Awesome. Well, I said, as an IT guy, that's a big part of my life too, is listening. And so thank you for that. And I said, to everybody out there that's listening to the show today, if you found, value in what we're doing and what I'm doing, please, subscribe to the show, share the show. We're on Spotify and Anchor and like Apple and Google and all these platforms. Every podcast platform you can think of, I'm on it. I have a YouTube channel, so you can catch this video on it. And I'm actually going to be changing that. I'm actually going to be doing Spotify video and Spotify audio, kind of going forward. So check that out. Of course, Larry and Sharon, if you know anybody out there that that wants to raise awareness for Crohn's and colitis, they can check out the Crohn's Veteran store. I have tons of awesome stuff for Crohn's and colitis merch on there, and with literally the sole purpose of that is to raise awareness, and I wanted the Crohn's awareness stuff that like looked cool and you felt cool wearing it, and because everything was like butterflies and like purple and stuff. And so like I needed to find something a little more non-gendered, so yeah, so I have actually just made a Crohn's Veteran gym bag yesterday for the store. So check that out. So yeah, I'm this year is going to be fun. I'm thinking about doing a YouTube cooking channel for IBD. With kind of like a father and son thing. So that'll be fun. And yeah, just trying to just grow awareness. And so you guys being on here talking about adhesions, this is so important for people that have IBD, and so important for people with Crohn's. And so I really hope people not only take something away from this conversation, but actually go to clearpassage.com and see what you guys are about to.
Hey, Jordan, let me mention one last thing. Let me thank you for your dedication and for everything you've done. I mean, I know how much work you have put into it, and you do put into this, working full-time, being a full-time father of several kids as well, and having Crohn's and doing this. Remarkable, and kudos to you, sir.
Hey, thank you. And a dog.
We realized early on that there was no diet guide for people that were having recurring bowel obstructions, and that the AMA diet guide of more and more fiber was just making corks and helping to create more business for the surgeons and us, which we really didn't want. So there is a diet guide for people with bowel obstruction who are having these recurring symptoms that Sharon talked about at our website. And on one page, there's like 9 different levels where you can say, oh, this is where I am. If I want to test the waters, I'll come up to this. Let me just back down to this. And it's more of a liquid diet at the bottom, and it's more of a full diet at the top. But so that's absolutely free. It's about a 42-page brochure. It's really beautifully done too, as well. It's at our website.
Very cool. Okay. Yep. You heard the man. Check it out. So, cool. Well, Larry, Sharon, thank you so much. Again, I'm wishing you guys continued success, and I hope you're able to help tons of more people for a long time coming. And again, check us out, Crohn'sVeteran.com, Crohn'sVeteranStore.com. And again, guys, thank you very much. Peace and love.
Thank you so much.